Venkatesh Karthikeyan is currently pursuing MD in Community and Family Medicine from AIIMS Patna. He did MBBS from Vellamal Medical College, Madurai, Tamil Nadu. He was awarded as the best medical student by IMA, and he is the State General Secretary of Indian Medical Association Junior Doctors Network, Tamil Nadu. He's also the National Vice President of All India Medical Association and former Students Wing President of UNESCO Chair in Bioethics. He is also the founder, president of Vellamal Medical College Unit of International Federation of Medical Students Association. He has conducted multiple awareness programs on menstrual hygiene and other public health problems. So today he's here with us to enlighten us about HIV, which is another virus to talk about, another deadly virus. So I would welcome you, sir, on behalf of NSS, FITM, and Teens of God, and we look forward for your presentation and wish you all a very happy learning.
Yes, thank you so much, Doctor. So I'd like to proceed forward with my presentation. Is that fine?
Yes, sir, it's fine.
Yeah. So good evening, everyone. First of all, a big thanks for joining this webinar despite our RCB versus CSK match going on. So HIV, another virus to talk about. So first of all, I would like to congratulate the organizers for taking such a topic. While the whole world is panicking about COVID-19, we tend to forget that there are other deadly diseases which definitely needs are addressed. So I thank Teens of God and FIMT for taking this initiative, taking this topic in order to create awareness among the most vulnerable population, that is the teenagers and the college going students who are in their early 20s. So as we know, COVID-19 is an alarming situation right now, and the second wave is speaking like anything. Being a postgraduate in AIIMS Patna, I'm seeing so many patients every single day. We find it very difficult to give beds to people, not only here but throughout the country. Getting beds and getting oxygen is a great deal. But despite that, there are other deadly diseases, especially HIV, which has claimed more than 3.8 crores, 3.3 crore lives across the globe, and 3.8 million people, 3.8 crore people are living with HIV currently. We always are brought up in a situation, in a setup where talking about sex is not very common. Is it bad to talk about sex? What is the right time to talk about it? In my opinion, early teenagers should be educated, should be introduced about this concept, and they should be given enough exposure so that they don't think something as sex as something unusual. We should first of all realize that this is not a fantasy. It's just another physiological process. So this distinction between fantasy and physiology is essential in order to make them understand that this is just another basic drive, like the need for food, the need for water, the need for shelter. So that once they understand that this is a physiology, they will start using the other things which are bestowed to the mankind, the higher mental functions, and try to explore other dimensions, previously unexplored regions of the world, which has never been before in this entire universe. So we should understand that reproduction, sexuality, all these is there for every creature, however tiny it may be, starting from bacteria till the highest in human being. Reproduction is a very common thing, and we teenagers, we early 20s should not waste time in fantasizing about it, rather than be aware of what is the concept, how to protect ourselves from associated risk factors, associated diseases, and move on to do something great. Because this higher mental faculty, we should explore it in a useful way, rather than just wandering about something which is not so great. Why should we talk about sex and HIV? Let us see a story of a girl, maybe from a typical Indian background, from a village background, who's a happy young girl in early teens, who has never been dare enough to talk about sex or ask about what sex means, what menstruation is, and she's grown up in such a way, and she's always surrounded by the stigma that talking about these kind of things is totally unacceptable. Suddenly she falls in love with someone, and then she decides to have her first intercourse. And as time comes on, she realizes that something is wrong with her. She is not as hale and healthy as before, and she's feeling to get some flu-like illness, some generalized weakness, some generalized swelling then and there in the body. And then she comes to know about what HIV is, gets herself tested, and unfortunately, she turns out to be HIV positive. So think about the condition of this teenage girl. Should her life end at the very beginning, even before it has begun? Does she even deserve this? And in worst case scenario, what about if she gets pregnant? Think about the condition. Think about the pressure this society is going to exert on her. And the worst case, think about the future of the child, which is going to be given birth by her. So all these would have been prevented if she was aware about the concept of using barrier protective methods, contraceptions, and protective methods. See, just if she was aware of this, and a single use of an protective mechanism, protective device would have led to prevention of all these complications, not only HIV, not only sexually transmitted devices, but also the unwanted pregnancy. So we are no one to decide what one should do in their personal life. But as a doctor, it is my duty in order to educate them about the diseases which are associated with unprotected sex, and what are the methods which can be employed in order to safeguard oneself against this. So, why this is a global issue? What is the difference between HIV and AIDS? What are the signs and symptoms of HIV? What are the routes of transmission? What are the risk factors associated? How to diagnose HIV? How to prevent it? And what are the treatment options available? So all these are going to be covered in the next few minutes. So we'll plan to take questions at the end. In between, if you have some irresistible doubts, you can always put up your hands. I'll be ready to answer. So why HIV is a global public health issue? As I said earlier, 3.3 crore people have lost their lives due to this single disease, this single virus. And 3.8 crores people are living with HIV currently. All this is according to 2019 data as released by World Health Organization. However, the increasing access to HIV treatment, HIV detection, increasing awareness, all these has made HIV quite a manageable disease. And though someone is detected with HIV, if we are starting treatment early, then we can assure them healthy and long life, and this is definitely a manageable condition, unlike which was there a few decades ago. What are the coverages of services? According to 2019 data by WHO, 68% of adults and 53% of children living with HIV, they receive the appropriate treatment. So it is just nearly 70% only. We need to focus towards 95%, towards 100% in the upcoming days. A great majority, that is 85% of pregnant and breastfeeding women receive ART. ART is nothing but antiretroviral therapy, which is the name for treatment given in HIV. About 81% of people living with HIV knew their status, out of which only 67% are receiving antiretroviral therapy. This clearly shows that those who have symptoms, they are not aware that they might have this condition. Though they are aware, they don't know where to go. They don't know where to go, which hospital to go, and if they go, what are the problems involved? Will their HIV status be revealed to his or her partner? Or will it be revealed to the company he is working in? What the society will think about me? So all these questions has bring down the number to 81%. And out of this 81%, the compliance also is not so good. About 67% only are receiving antiretroviral therapy. And 59% of these total HIV patients have achieved suppression of HIV virus with a no risk of infecting others. What is the impact of COVID on HIV? As with any disease, as with anything in the world, COVID has shattered all the programs, all the systems, and HIV is not an exemption. So this HIV testing, HIV treatment, all are badly affected by this COVID virus. It started to recover by the end of 2020, but again now due to second peak, all the system is completely disrupted, and this is posing us a huge threat. Nevertheless, between 2000 to 2019, in the past 2 decades, the new HIV infections fell by nearly 40%, and the HIV related deaths fell down by 50%, which is like 1.5 crore people are saved due to antiretroviral therapy. So, this is the beauty of science. This is the beauty of modern medicine. If we are able to increase the coverage of HIV testing, increasing the accessibility, and motivating the people to take drugs regularly, then we can save much more lives. It is definitely possible. For that, conducting awareness programs like this also plays a vital role. Who are at risk? Men who have sex with men, homosexuals, people who inject drugs, people in prisons and other closed settings, sex workers and their clients, and transgender people are the most common to be affected, who are at high risk of getting HIV. And transgender people, they're also a separate community of people who are exposed to all these kind of sexually transmitted infections. First of all, what is HIV? HIV stands for immunodeficiency virus. This basically targets your immune system and decreases the immune cells. We commonly call it as CD4 cells. The CD4 cells are being targeted, and the total number is brought down by this HIV virus, thus making a person immunodeficient. Immunodeficient is nothing but if someone is getting a cough and cold, someone healthy like you and me, if we are getting cough and cold, it will just go off with the natural immunity. But if someone with a HIV, with the HIV virus with a less CD4 count is exposed to these kind of common infections, even that might prove to be fatal. That might kill the person. Even a common flu can kill a person whose immune system is not so good. So, because of this reason, HIV is evolving as a deadly disease by bringing in a lot of opportunistic infections and lot of cancer to those who are affected. What is the difference between HIV and AIDS? Are they essentially the same? No. HIV is the infection with the human immunodeficiency virus, whereas the advanced stage of HIV is called AIDS. It is a full-blown stage. This development from HIV to AIDS may take as long as 10 to 15 years, but this is not a constant exact number, as it varies with the viral load, with the compliance to the treatment, to the antiretroviral therapy. There are multiple factors which decides the progress of HIV into full-blown AIDS, which is acquired immunodeficiency syndrome. AIDS is defined by development of certain cancers like Kaposi sarcoma, few infections like esophageal candidiasis, or other several long-term clinical manifestations. So, what are the signs and symptoms? So, this varies depending upon the stage of infection. Most people are infectious in the first few months. In the first few weeks after the initial infections, patients might experience no symptom at all, or they may experience flu-like illness, headache, fever, rash, sore throat, and in the later stages, they might experience swollen lymph nodes, which is nothing but bulges in different parts of the body, especially in the inguinal region, in the axillary region, and all. They might have weight loss, they may have fever, diarrhea, and cough. Without treatment, they could develop severe illnesses such as tuberculosis, cryptococcal meningitis, severe bacterial infections, cancers such as lymphoma and Kaposi sarcoma. How it is transmitted? HIV is basically transmitted by blood, breast milk, semen, vaginal secretion, and it's transmitted from mother to child within the womb or during the process of delivery or while breastfeeding also. This is yet another important slide which helps to break the stigma myths around HIV. So will HIV be transmitted if my friend is positive and I'm just in normal contact like shaking hands or hugging or sharing food, sharing water, sharing personal objects? No. according to WHO and other scientific organizations, HIV is not transmitted by these kind of day-to-day activities. So I don't see any point in stigmatizing, in keeping these people away without touching them, or just treating them by what to say, discriminating them is not at all warranted, because it is not going to be transmitted by these kind of activities. It is also important to note that HIV people who are on antiretroviral therapy, that is for taking treatment and virally suppressed, they do not transmit HIV to their partners. So it is essential to detect the HIV early, to start the treatment early, so that it does not improve the well-being of the patient alone, but also it helps in preventing the transmission from the patient to his sexual partners and peers. What are the risk factors for transmitting HIV? First one, unprotected anal or vaginal sex. The next risk factor is other STIs. STIs means sexually transmitted infection. Not only HIV is a sexually transmitted infection, there are many other sexually transmitted infections like gonorrhea, chlamydia, and all. So sharing contaminated needles, contaminated syringes, and other injecting equipments are also a risk factor. Even not only drug abusers, but even general public might also put at a risk when they are using unsterile needles in the hospital settings. So it is mandatory to use disposable needles only in the hospitals, and not only that, we should also clean the injection site properly. This even if you are being a student, if you are going to take vaccinations, or if you are going to hospital for any procedures, if not sisters or doctors are not using a disposable syringe, or they're not cleaning the injection site properly, you should request them to clean the site properly. It is your basic right, because not only HIV, many infections are possible with such unsterile procedures. And receiving unsafe injections, blood transfusions, tissue transplantation, and medical procedures that involve unsterile cutting and piercing are also risk factors. Like even tattooing, nasal piercing, all these kinds of interventions, which breaks the integrity of your skin, poses a risk for transmission. So better avoid these kind of tattooings or piercings, and if you think it is mandatory, then do it from a good center where proper sterile precautions are followed. And yet another common reason for transmission, which is common among medical students and doctors, is needle stick injuries. So, like while injecting a patient, when they try to recap, or while doing surgeries, while suturing, they might be exposed to needle pricks. And if the patient is HIV positive, then this doctors and medical students are again posed to this risk of carrying HIV. So, how to do diagnosis? Rapid diagnostic tests are available, which provides the same day result. The concept is pretty simple. See, if you are getting HIV, if the virus gets into your body and the body tries to fight off that virus, so something called antibodies is produced. In these tests, like rapid diagnostic tests, ELISA and all, we are going to try to detect those antibodies, which is nothing but the response of our own body to the foreign particle, which is the HIV virus. So, if our blood sample is containing these antibodies, in layman term, we can say that these are something which is produced against the disease. If we are finding these antibodies in the blood, in your blood, it means that you have been exposed to HIV virus. So, this rapid diagnostic test helps you in finding out whether you have HIV or not. But be mindful, getting a positive result or getting a negative result in these rapid diagnostic tests does not mean that you are having or not having a disease. It is not 100% confirmatory. To be frank, no single test is 100% confirmatory. Hence, we use a set of tests in order to label a person as HIV positive. Because labeling a person as HIV positive is itself going to change a person's entire life, and we can't afford to make any mistakes in diagnosing. So these rapid diagnostic tests, they can be availed from the ICTC centers, and they can be used to test ourselves. Let's see what is ICTC centers in the upcoming slides. As I said earlier, no single test can provide a full HIV diagnosis. Confirmatory testing is required, and this test should be done by a well qualified technician in a qualified lab. That is more important. Most widely, the used HIV diagnostic test detect antibodies produced by the person as a part of their immune response to fight HIV. So, as I said, ICTC Center is where you can find materials to about HIV, where you can find diagnostic kits, where you can avail treatment. ICTC stands for Integrated Counseling and Testing Center. Where are these ICTCs? ICTCs are generally available in all government hospitals, either in their medicine OPD or in their obstetrics and gynecology OPD. So these ICTC centers should be made use to the fullest. What is the purpose of ICTC center? It is to conduct HIV diagnostic tests. It is to provide basic information on the modes of HIV transmission. It also promotes behavioral changes to reduce the vulnerability, and most importantly, it is not only going to help you in diagnosis of HIV, but also it will link you, it will guide you for the treatment and other support which is needed. We do have a counselor in almost all ICTC centers who will be telling you, will be guiding you how you should be compliant to your treatment, what are the things which can be done to extend your longevity, and whatever doubts you have, you can feel free to talk to them. And you might have the query that, will my identity be kept confidential? Will my status of HIV be kept confidential? Yes, healthcare workers are bound to maintain the confidentiality of the HIV status. But there are a few catches which I will discuss in the upcoming slides. There are also apps available in the Play Store developed by World Health Organization in order to help you know about what are the HIV testing center services available. So if you have further doubts regarding treatment or regarding anything related to HIV, you can directly go to the WHO website. And if you want Indian guidelines, you can go for the you can Google NACO, NACO, National AIDS Control Organization. So these you can make use if you want to learn more about HIV. And yet another common but not so well understood concept among general public is the window period. What is window period? First of all, as I said, HIV virus is a foreign particle which is going to come inside the body. So when it comes inside the body, our body tries to fight it off by producing antibodies. But this is not a process which takes place immediately. If the virus comes inside the body, it will take at least 28 days to produce a certain quantity of antibodies which will be which will be detectable in the routine test which we are doing. So this 28 days time frame is called window period. For example, if a person is having sexual contact with the HIV positive person today, though his test will be positive only after 28 days. So in this 28 days period, whoever is coming in sexual contact or body fluid contact of this new person, they might get HIV positive. They might be contacting the virus and they might get HIV, which means that if you are doing a test in this 28-day period gap, like day 1 to day 28, the test will be negative, but the risk of transmitting HIV is always there. So this is the common phenomenon called window period, where the test is negative, but the patient is actually harboring the virus and is capable of transmitting the virus through body fluids and blood. So following a positive diagnosis, patient should always be retested before they are enrolled in any kind of treatment and care to rule out any potential testing or reporting error. We cannot afford to make a mistake in diagnosing HIV. We should not label a normal healthy individual as HIV positive person at all. We should be very much cautious about it. And notably, once a person is diagnosed with HIV and has started treatment, there is no scope for doing the test again. You can repeat the test any number of times before starting the treatment. 2 times, 3 times, depending upon the guidelines and depending upon your satisfaction, you can repeat the test any number of times. But after diagnosis and after starting treatment, there is no point in doing so. Can I be forced into HIV testing? This is another common query among the general public. No, HIV testing is 100% voluntary. No one, not your parents, not your spouse, not your wife, not your husband, no one can force you into HIV testing, and you have all the right in this world to decline the test. WHO also recommends HIV partner notification services. Like if you are testing positive, it is your duty to inform your partners voluntarily, your sexual contacts voluntarily, to go for testing. This is essential in order to initiate to detect HIV in the partners in your sexual contacts early, which will also facilitate early starting of treatment and a better prognosis. What are the 5 C's of HIV testing services? First thing is informed consent. So, if as a doctor, if I'm going to take test for you, I should get a consent, not a verbal consent, but also it should be a informed consent. I should get in writing that you, as a patient, are ready to give the HIV testing. As a doctor, it is my duty to maintain confidentiality. I should not share it with my friends. I should not share it to my circle. I should not gossip about it. Your status of HIV should not be revealed to anyone. And there are few other gray zones in this regard of confidentiality, which we will discuss later. And counseling. So if you are coming for testing, I should counsel you, irrespective of whether the test is negative or positive. You might be into so much anxiety. You might be into so much of just going to ICTC centers, just getting yourself tested for HIV itself is going to cause you a lot of what to say mental suffering. So as a doctor, it is my duty to counsel you appropriately, to hear to you patiently, and tell words which will soothe you. And correct test results, giving correct test results is also a topmost priority. Rather than giving quick results, giving the correct results also plays a vital role. And it is my duty to link you to the treatment facilities and other services essential for HIV positive people. How can we prevent? Prevention of HIV is mainly by limiting the exposure. So there are two main things. First thing is to limit the exposure, and second thing is to use all the modalities in a combination. Like if you are using a condom and and expecting that you're 100% protective against HIV, it is not so. So you should make use of multiple modalities in a combination. Like you should practice abstinence, you should limit the number of sexual contacts you have, you should use condoms. Like that, multiple things should be combined together in order to bring the risk of HIV to almost zero. So what are the things which you can do in order to prevent HIV transmission? As I said, male condoms and female condoms can be used. These condoms are available free of cost in government settings, and this is 85% plus protective when used correctly. Not only protective against HIV, but as I said earlier, it is protective against other sexually transmitted infections and against pregnancy also. So this is the how a female condom looks like, and this is the procedure for insertion. Harm reduction should be done for people who inject and use drugs. Like we should use sterile injecting equipments. We should not share drug using equipments and drug solutions. And more importantly, these people who are taking drugs, intravenous drugs, they are so much addicted to drugs that they cannot live without drugs. In such case, we should counsel them. We should refer them to psychiatrists and get them, like what to say, treatment for drug dependence. So for example, opioid substitution therapy may be used in order to bring down the craving for the intravenous drug abuse. So like that, proper counseling and proper treatment for drug dependence also significantly reduces the risk for HIV transmission. So, testing and counseling for HIV and STIs. It is strongly advised. Testing is strongly advised for all people who are exposed to any kind of risk factors which we discussed earlier. This enables the process of learning of their own HIV status and helps them to access the necessary prevention and treatment services without delay. So, it is, as I said earlier, it is important for early diagnosis, early treatment as well for a long life. WHO also recommends offering testing for partners or the couples. And next, yet another modality which needs discussion is HIV-TB. So HIV and TB are so closely related to each other that most of the people with HIV have TB and many TB patients have HIV. So it is so fatal that TB is responsible for 1/3 of deaths in HIV related cases. And early detection of TB and prompt linkage to TB treatment and ART can prevent these kind of deaths. TB screening should be offered routinely to the HIV patient and vice versa. That is, HIV patients should be offered TB screening. I mean, TB screening should be done for HIV patients and HIV screening should be done for TB patients. Individuals who are diagnosed with HIV and active TB should urgently be started with therapy. So generally what we do, we treat for HIV first, we treat for TB first and then treat for HIV. This is because TB treatment is mainly involved with killing the microorganism, Mycobacterium tuberculosis. So this bacterium killing is more important than treating the HIV. So TB treatment is always done first, followed by antiretroviral therapy. And yet another yet another upcoming uh, upcoming preventive strategy is voluntary circumcision. In case of male, the foreskin can be removed surgically, and this is known as circumcision. This voluntary male medical circumcision reduces the risk of sexually transmitted infections by 50%, and it can be done in male for more than 15 years. So this is like a permanent and partial solution for protection against sexually transmitted infections, including HIV. So, when we are starting this antiretroviral therapy, that is the treatment for HIV, we are going to suppress the viral load, and this helps in preventing the transmission to the uninfected sexual partners also, apart from being beneficial to the patient himself. So WHO recommends all the patients of HIV to be started on antiretroviral therapy irrespective of their CD4 count, irrespective of the clinical presentation. So if you are having HIV, you should be started on the drug therapy. You should not wait for anything. Pre-exposure prophylaxis of HIV negative partner. If suppose your partner is positive and you are negative, but still you don't want to contract infection from your partner, then you can opt for pre-exposure prophylaxis. It is beyond the scope of this webinar to discuss the drugs, but what I would like to say is that you can either use it on a daily basis or you can use it as an event-driven pre-exposure prophylaxis. That is just before and just after an intercourse with a HIV positive partner, and a combination of all these preventive approaches, as said earlier, is essential in order to safeguard yourself. So, what is event-driven pre-exposure prophylaxis? This is taking 2 pills between 2 hours and 24 hours before sex, and a third pill 24 hours after the first 2 pills, and a fourth pill 48 hours after the fourth pill. So, in summary, this is like we are taking 4 pills. So, the first pill should be taken 24 hours before sex. The second pill should be taken 2 hours before sex. Then the third pill should be taken 24 hours after sex, and the fourth pill should be taken 48 hours after. So this is known as event-driven pre-exposure prophylaxis. What is post-exposure prophylaxis for HIV? This should be taken within 72 hours. For example, if you are exposed to HIV fluid, HIV positive patient's fluid or blood, for example, an unprotected intercourse with a HIV positive person or a needle stick injury, then you should report immediately to the ICTC center where you will be given due first aid care and counseling, and HIV testing will be done. This even if your testing is negative, irrespective of your results, you are going to be given HIV therapy for 28 days, and followed which you'll be taking the test again and decided whether to continue or not. So if you think you are exposed to HIV positive person, report to ICTC immediately as early as possible. Don't wait for 72 hours. Getting within 72 hours is good, but the more quicker you reach, the more better. WHO recommends post-exposure prophylaxis for both occupational and non-occupational exposures. Occupational exposure means, being a doctor, if I am exposed to needle stick injury, that is called as occupational exposure. And being a non-healthcare worker person, if you are exposed by having a sexual contact with another person, that is known as non-occupational exposures. In both the case, be it adult, be it children, you should be started on post-exposure prophylaxis promptly without any delay. And mother to child transmission. In the absence of any intervention, without taking any drugs, the chances of transmitting from mother to child is 15 to 44%. So this can be almost eliminated if we are starting the treatment in the correct time and being compliant to the treatment. So, as I said earlier, WHO recommends lifelong antiretroviral therapy for all people living with HIV, irrespective of their CD4 count and the clinical stage of disease. This also includes pregnant and breastfeeding women. So, you might ask, is a pregnancy and breastfeeding a contraindication? No, it's not a contraindication because the risk of transmitting virus is much more higher, and the ill effects due to HIV is more when compared with the risks with the side effects of taking the medicines. So for people living with HIV who are not diagnosed or not taking antiretroviral therapy, it might be converting into a full-blown AIDS in next 10 to 15 years. But if you are being compliant to the treatment and if you have been diagnosed early, then the risk is much more lesser. Evidence from several studies shows that people who have undetectable viral load cannot pass HIV to others, and the risk of transmitting HIV is greatly reduced when they are adhered to the treatment and when the treatment is started without any delay. So, you might think this is an overemphasize. That I'm overemphasizing that we should take early detection. It's important to detect early and treat early, but there's nothing wrong even if I say 100 more times. So, it is that much important. And this is the NACO guidelines for treatment of HIV. What are the drugs given? Again, this is beyond the scope of this webinar. As I said, there are apps and many educational videos available in the official WHO website itself and the Play Store for HIV related queries and treatments. So what are the structural barriers? Like how can we address these barriers? So discrimination, as we know, is the main issue. So anti-discrimination and protective laws to address the stigmatization and discrimination should be done. We should make this healthcare services available, accessible, and acceptable. It should be if I want, I should know where it is. I should be able to go to that place easily, and that should have an acceptable, and that should be given to me in an acceptable way. And addressing the violence against people from key population like transgender population, all these should be addressed duly by the lawmakers. And expanding access to the treatment is the heart of a set of targets for 2020. So as healthcare professionals, my duty and my team's duty, the government's duty, is to make these testing kits, these medicines accessible so that people can easily make use of them in an efficient way. And yes, there is no cure for HIV infection till date. Researches are going on. Bone marrow transplantations have been tried, but it will take a few more years, to at least a few more decades, to get a cure for HIV. So all that we have now is a proper preventive strategy and early diagnosis and early initiation of treatments. What is the preventive strategy? Summing up once again, it is preventing mother to child transmission, using of male and female condoms, harm reduction intervention, pre-exposure prophylaxis, that is before the event, post-exposure prophylaxis, that is after the event, voluntary male medical circumcision, which is nothing but removing the foreskin from the penis of a male, and antiretroviral drugs. So it is again, I would like to mention that all these should be used in a combination for better coverage. Not a single method would warrant 100% protection against HIV. We should be using them as many strategies as possible in order to protect ourselves and to prevent the transmission from one person to other. So, this is my final slide. Mercy. We should be merciful to people who are diagnosed with HIV, and mercy also means thank you in French. And yes, have displayed this watch to show that my time is up, and this watch, the display of this watch, quite summarizes the core of my presentation, and that's it. I'm ready to take the questions. And you can contact me, and I'm available. I'm active in Facebook, Insta, Twitter, and YouTube. You can connect me through any of these platforms. My name is Dr. Venkatesh Karthikeyan in all these platforms. You can feel free to contact if you have any doubts.
Thank you, sir. It was such an enlightening lecture.